Have you ever noticed a child who seems just a little bit quieter than their friends or maybe struggles to find the right words? Well, today we're going to dive into a condition that affects millions of kids, often in silence. It's called Developmental Language Disorder, or DLD for short. It's a hidden struggle, for sure, but the journey of progress, well, it can be pretty inspiring.
Now get ready for this number because it's pretty staggering. Nearly 1 in 4 children experiences some kind of language difficulty. Think about that. In an average classroom, that means several students could be dealing with this, and a lot of them might not even have a diagnosis, which can really affect them down the line.
So let me ask you, if you're a parent or a teacher or you just have kids in your life, have you ever had that little worry in the back of your mind about a child's speech? You notice they're a bit quieter, or maybe their sentences don't quite connect. It's such a common concern, and today we're going to unpack what could be going on.
And this is so important because when DLD goes untreated, it isn't just about speech. The impact can create these ripples through a child's whole life. We're talking about everything from how they do in school, to their ability to make friends, their confidence, and even their future opportunities. It's a real struggle, but it's one we can absolutely do something about.
Okay, so what exactly is this disorder? In this next section, we're going to decode DLD. We'll get a really clear, simple definition, and, just as important, we're going to clear up some pretty common and honestly harmful misconceptions about what it isn't.
So at its very core, DLD is a condition where a child has this persistent, ongoing difficulty with language. And that means both understanding what's being said to them and using words to express themselves. Now, the key phrase here is without any other clear cause. It just means their brain processes language a little differently. That's it.
And this distinction is absolutely crucial. DLD is a brain-based language difference. It's not caused by hearing loss, it's not autism, and it's not an intellectual disability. And let's be crystal clear on this last point. It is absolutely 100% not the result of poor parenting or a child just being lazy.
So, what are some of the signs you might notice? Well, a child with DLD might use really short, simple sentences, much more so than their peers. You might hear common grammar mistakes, like her fell down instead of she fell down. Trying to tell a simple story from start to finish can be a huge challenge for them, and so can following instructions with a few steps.
In this quote, it just hits the nail on the head. These children are talking. They have thoughts, they have ideas, they want to communicate. The problem is the gap between what they want to say and the language tools they have to say it with. Their skills just aren't at the level you'd expect for their age.
Okay, all the theory is great, but a real story makes it so much more tangible, right? So let's meet a 6-year-old boy we're going to call Aryan. His story really shows what DLD can look like in everyday life, and more importantly, how therapy can change absolutely everything.
This is how Aryan was communicating. Just listen to that for a second. Me, want, this ball, give me, play. You can just hear the effort, can't you? The ideas are there. He wants the ball, he wants to play, but the words are all choppy and disconnected. That's the reality of DLD in action.
So when he was assessed, the data confirmed what his parents were seeing. At 6 years old, his mean length of utterance, or MLU, which is basically just the average number of words in a sentence, was only 2.0. To put that into perspective, a typical 6-year-old is using much longer, more complex sentences. Aryan could barely get a simple story.
And, this wasn't just about his words. His struggles with language made him really shy and withdrawn at school. He had a hard time jumping into games with other kids, and he'd completely avoid situations where he might get called on to answer a question. His world was getting smaller and smaller.
But this is where the story takes a turn for the better. Aryan started speech therapy, and for the first time, there was a clear, structured path forward. So let's take a look at the actual treatment plan that started to unlock his potential and give him his voice back.
His therapy was this really great, comprehensive plan. For example, sentence expansion. That meant if Aryan said something like, dog run, the therapist would come back with, yes, the big brown dog is running so fast. It's this gentle modeling, combined with fun vocabulary games and practicing storytelling, that created this amazing environment for him to learn.
Okay, so just to remind you, let's remember where he started. His mean length of utterance was 2.0. He was communicating in tiny 2-word phrases.
Now, check this out. After just 4 months of consistent therapy, his MLU jumped all the way to 3.5. That is a massive, massive leap. It represents a huge increase in his ability to form more complex thoughts and actually say them out loud.
And the progress didn't stop with that one number. In those same 4 months, Aryan's vocabulary literally doubled. He started using 5- and 6-word sentences. And maybe the most important thing of all,
His confidence just soared. He started putting his hand up in class, playing more with friends. The change was completely transformative.
Aryan's story is incredible, and it shows the power of therapy. But parents and caregivers are such a crucial part of the team. So that brings us to the question, what can you do at home to support a child's language development? Let's talk about some simple, practical strategies.
Here are 4 key things you can do. First, gently model correct sentences. So if a child says, "her running," you can just reply, "Oh yeah, she is running so fast." See? It's about showing, not correcting. Also, expanding on what they say, playing simple word games, and limiting screen time to encourage real conversation. All of this makes a huge difference.
So what's the one thing that ties all of this together? What's the secret sauce? It's consistency. Whether it's in therapy or just chatting at home, it's the small, steady, everyday interactions that build the foundation for truly remarkable, lasting progress.
We'll end with this thought. DLD isn't just about learning to talk. It's about a child finding their voice and their place in the world. By spotting it early and giving them the right support, we're not just unlocking their words, we're helping them unlock their entire world.